our research was actually derived from the observation that ablution is one of the causes of transmitting pathogenic organisms. And as Bobby said, diarrhea kills about 1 or 2 million children a year due to dehydration and consequently vascular collapse, cardiovascular collapse, and then the children die. And so the infection is really the major factor that causes diarrhea and eventually death. Now, when we examine this aspect, we see that everybody actually defecates, and that is the management of the defecation, after defecation process that brings about problems and transmission of pathogenic organisms. And this is due to the fact that quite a number of the way one can really handle residual stool after defecation is either to use toilet paper, or in poor countries they would use scrap paper or leaves or any cellulosic material they can lay their hands on. And in many parts of the world, especially Muslim communities, the residual stool is wiped away by using hands, water, and water. So there are these dangers that the residual stool has to be, first of all, the hands have to be in contact with the stool, and then using water to wash it away. And therefore, the hands are definitely contaminated right away. And as we will see later on, that that water is actually used, placed in a bucket, and then communally used by the household. And in the houses the households that we visited, there were no facilities of hand washing after an ablution. And therefore, it means that the hands of those people who are practicing an ablution are actually contaminated, and they go about making food, feeding their children, washing their kitchen utensils, and so on, and touching knobs or materials that are in the household. So this is the major cause of actually spreading the pathogens through an ablution. And the water that we examined from various parts of Kenya, in Kisumu, and in Musoma in Tanzania, 90%, over 90% of the water that is used for an ablution is actually contaminated with the pathogens. And therefore, we concluded that the people actually practicing an ablution are actually spreading the pathogens everywhere. And from there, they go and shake hands with people. They go and hold babies. So this, and they hold currency and so on. So this is the way that actually pathogens are passed on from place to place. This observation has been observed that actually when we went to the literature, we found that countries actually which practice an ablution in the Middle East, in South Asia, Africa, we find that the cases of deaths due to diarrhea are actually located in those countries which practice an ablution, where Muslims believe that actually the only way that you can rid of contaminants from your body is to actually wash. But the problem is that they don't, after an ablution, they don't use soap and water. They just go about, after an ablution, they just go leave the toilet facility and then go and meet people, do all their chores without realizing that their hands are actually contaminated. So we saw that there was a correlation of countries which actually practice ablution and death due to diarrhea. Now, the preventive measures after ablution, we realized that since the hands are the ones actually that do most of the chores in the house, and you also you can find that these people also are probably preparing food in restaurants, in institutions, in hospitals, in prisons and other public places. This is the mode of transmission, and the only way that we can arrest this is actually to use a hand sanitizer. Hand sanitizers are available, and we can see that sorry, this is a slide on actually the inhibition of pathogens by using a plant extract that we are going to talk about just now. That is, we have to resort to using sanitizers. That is, if we want to check all the organisms from actually contaminating, spreading out, let's use a sanitizer. These sanitizers are now available in hospital halls. That is, after visiting a patient or when you are coming out from the patient, from seeing a patient, you actually apply the hand sanitizer on your hands and then go away. So the need of actually developing hand sanitizer and actually using them, it should be encouraged. The problem now is that the hand sanitizers are actually available are those which are alcohol-based or those which use synthetic benzalkylonium salts. The alcohol-based ones actually contain alcohol, about 60 to 65% ethanol, and these are actually responsible for defatting the hands and actually exposing the hands for further penetration of organisms. But they are still used to some extent to sanitize hands after, before eating or even when we are coming in the aircraft. They supplied towels which had hand sanitizers on them. So the only problem that we are now seeing is that these hand sanitizers are expensive. They are responsible also for scaling of hands and defatting the hands and so on. And some of these synthetic ones, like the benzalkylonium ones, they have got also probably they are suspected to have cancerous effect. So we thought of developing a natural hand sanitizer, and we came upon the property of say a plant called Senecio lyratipartitus, which grows widely in East Africa. And this material actually, when extracted, the extracts in hexane, ether acetate, chloroform can inhibit organisms that are responsible for diarrhea, mainly Salmonella, E. coli, and Klebsiella, and so on. So we went about looking for this plant so that we could be able to develop a hand sanitizer from here and formulate it such a way that it can be used for countries where they cannot afford hand sanitizers or where they practice ablution. And here is the plant itself that grows in East Africa, and it is currently not competing with any commercial use, so it can be used effectively, extracted and used as a hand sanitizer. Now, we have already got a sample of the hand sanitizer that we developed, that is here in a tube. We extracted the plant material, and then we're able to put it, compound it in a petroleum jelly, and it can be applied safely on the hands. This plant material, by the way, is used by traditional healers, and it is not toxic, and it is eaten by goats and cows, and therefore it can really be developed easily as a hand sanitizer and reduce incidences of diarrhea. I think that's the end of the presentation.